falling was something like second nature to me. I would do something in a hurry and fall. Just like that, suddenly one day my hand was not working the right side, and I got scared. So I immediately picked up the phone and I talked to Dr. Prashant, and I told him, this is what is happening. Just leave what you're doing and come immediately, he said. So I went over there to the specialist, the now specialist. MRI was supposed to be about 7,000. So he just sliced that off and he said, you go immediately there. If you didn't bring money, also no problem. You just tell them my name. So in that way, I felt he was like one in our family. And at times I tell him, God must have you to help us always, not only with me, with every needy patient. And he is a gem of a man. I've never seen him angry, but gem of a person. And he treats us like his own people, own members of the family. That's the thing. He was very calm, cool, and I saw it on the video. So I said, this is the person who's needed for this hospital. And everybody feel comfortable when they come here. I've seen many doctors, and not praising this man, but he's just that.
But he's firm and she went taking him for a checkup. Lift your leg. She was so, lift the leg. You're not sick. Lift. That's what you should do.
I was shocked.
He's the right man for you.
I was shocked at that time. I've never heard him raise his voice, And he said, just lift the leg. I'm asking you to lift your leg. I cannot, I said.
But you did that, you lifted?
No.
Yes, you held your leg, your thing, took out your socks, then you put your leg down.
I never trusted anybody else, but Dr. Prashant, I trust him like he's my very own, like that. Even Bianca will tell me, Mommy, he's a doctor and you're just casually talking like this, and he'll say, just keep quiet, let her talk. Titanium rod he put, and he told me it's a very strong metal, so you have to be careful now. And I was telling him, I want to walk back again. He said, I want to see you walking into my clinic. I don't want to see you having any attachments and, any aids to help you walk. He sorted it all out. Until now, I don't feel any pain or any discomfort. There's no such reaction to what he has done.
So I see a lot of old patients who come with fall from at home and with slip and fall. And in a week I get about at least 3 to 4 patients per week with hip fractures of the leg. And they are a bit of difficult candidates to operate because the bones are fragile and the healing takes a long time, and I can't keep all old people in the bed for long, because if we keep them for long, then bed sores, lung infections, urinary tract infections. So that's the reason why with whatever age we always tell them to get the surgery done. And this patient, Mrs. DeMonte, who came to me with a history of fall, she's a very heavily built patient, and she came to the ER with fracture of the hip joint and what we call trochanter. That's the most common fracture at this age, and I had to face a lot of problems. One is with her age, next is bone quality, next one is diabetes, hypertension, and one more thing is what she had, a DVT, what we call, and that is deep vein thrombosis, that is blood clot in the legs. So this was a challenge to us, because the surgery required a lot of I would say a complete setup where my cardiologist have to work on her, I have to do the surgery, my anesthetist have to do the right things, and it was what we say a combined effort of all the doctors. And I use so we worked her up, and yes, it was a high risk surgery, and what to do? We had to do the surgery, because if you want to see the patient walk, then we need to take the chance. So we went about and did the surgery. I was very happy with the surgery, and next day I made her stand, and next day and put her on a wheelchair, and everything went on well. And that is where the whole satisfaction of the surgery is. And she gradually improved. For me, most of the old patients, what I require is, I want them to be independent. That's all I want. I want them to do their routine day-to-day activities, like going to the toilet, bathing themselves, sitting on a wheelchair, with minimum support for initially for few months. And that is my most important aim. And I think I achieved with her, with lot of comorbidities and challenges in that particular case especially. So, and finally, I'm happy that she is up and about walking around, and I would say this is a success story of orthopedics, not rather than me, where we believe life is movement. And and actually I would actually congratulate the patient also, where the will to live is very important. Maybe I might do a very good surgery, but the will to live, that hunger to live, hunger to walk, that's most important, I would say. Thank you.
After the surgery, I was a bit nervous, thinking, will I be on my feet again? Because the way I was told by my daughter, that you have to be very, very careful. One, because of your weight, and the other is because you're always in a hurry. So she organized, she told me, yes, you can get the services from the specialist, that is Mr. Stephen for the physio, and things will work out well. Whom he also made me feel very comfortable, like there was no kind of master and student affair. I really appreciated this man, because I never knew that a person like him, a young man like him, will be able to help me get on my feet too, which I am now. Then the home care, the caregiver, whom the home care people sent for me, was somebody really good. She really supported me, like in everything. Gives me a bath, makes me feel comfortable. At times she bosses me, but then I threaten her.
But that's necessary.
Yes.
When my daughter changes her pampers, she'll make all the fuss. She'll tell us, say, Harita's the right one for you.
And she knows exactly what to do. That's why when Stephen went on leave, he told her, Parma, you please see that you do the exercises. She watches when he does all the exercises with me. She's also there to help me in case to get down from the cot or whatever. And then she will tell me, now it is exercise time. You have to come for your exercises. Come on. I'll say, not today. I'll go for my nap and then I'll come back. No. After your nap, you will never come to do exercise. You'll say, it's time for lunch now and I'm not coming. So like that, I used to dodge her. But then after that, I understood that if I do all those things, everything's going to work the right way for me. She tries to boss me at times, and I really put her in a place.
She'll say, enough. She said, no, one more.
Yes, the physio and Harita don't leave me. They know I'm a cheater, a shortcutter. They know that. And Stephen, I threaten him like this. With my finger, I just threaten him. I say, nothing doing, be careful. And sometimes I literally scold him too. I always ask him, does any of your patients treat you like this? And he said, no ma'am, no. So I am the horrible person now. I just tell him like that. But there are two people whom I miss terribly when they are on leave or something. Yesterday she had a chest pain and she didn't come. really, and she comes the next day, that is this morning, and she asked me, how did you manage without me?
I think the missing her part of it is true, in the sense that they've gelled in such a way that she actually misses her. Even though it means walking like one more round or two more rounds, they've gelled nicely. She helps her go to the toilet and change her pampers, change her dress, gives her a bath. She misses all that.
Demonte ma'am, after her fall, she was very nervous and she was not willing to do. She gave up everything. So it took time for us to motivate her and to bring back to normal. We focused on her ankle movements and strengthening her knee and hip. So we started with ankle anti-DVT exercise, ankle movements, and static quadriceps exercise, and hamstring exercise, and knee bending we started. And she's, with support only, she is able to get up off the bed. So we need two people support to make her active. And slowly we started assisted exercise. So she was feeling confident after 2 weeks of physio, and with assistance she was doing the movements, and with home care support, caretaker was there and she was assisting us, and we both were able to make her sit. And now she is walking with walker, and she wants to go for a walk without walker, and she wants to be independent. So our aim was to make her active in her functional activities and independent. Now she's going to bathroom, she is having bath, and she's doing her activities, daily life activities, and now she is very happy.
The lab people were very, very prompt in coming, taking my blood samples, and they did it so nicely that I didn't even know the prick was already done. Very, very cleverly, very carefully by one Mr. Mohammed. If Mohammed is there, I will do the blood works, but not anybody else. That way I became very selfish with the specialist and possessive as well. I think they report to Dr. Prashant after that. Even Stephen reports to Dr. Prashant about every week how the improvement is. And accordingly, that was a very nice system which I really enjoyed with, or understood so well, that the doctors in specialist really meant to, be with the patient and see that they are back to normal. The services that they have provided me, like the home care, the physio, all this is really something that they have taken care and sent me the right people. It's like a miracle for me, because I never thought I would walk, or I would walk normally. People used to say they have a limp and all these things, but this is not there with me. It's so very normal, and my experience with specialists has been a family affair kind of thing, because I never expected doctors or anybody from a hospital to have such close relationships with me and take on all my tantrums.
Mrs. Judy DeMonte was admitted to a specialist hospital as she had a fall at home. Suddenly at night, 10:30, around 10:30 in the night, she was immediately taken into our emergency room, and care was given to her, first aid care as well as immediate care of her condition, which was a fracture in her femur. Nursing care was provided with basics of vital signs, and immediate traction was given as per doctor's orders, and then she was posted for surgery the next day. So she was transferred into a room, into a private room, where she was given comfortable nursing care, and all her needs, including her vital signs, her dressing needs, and her comfort needs were provided. Nursing care was given by 2 hourly, and because of she's a diabetic patient, which also increases the risk of post-surgery complications. So all of that was taken, and it was maintained in a nominal fashion. So the next morning she was posted for surgery, and her surgery was successful. Following which, when she was back in her room, post-op care was provided to her as per her needs and doctor's orders, which was minimum ambulation, So she needed more of nursing care, where she needed to be moved, ambulated, turned from side to side, so that she has some movement in her legs because of a lot of pain post-op surgery. Pain medication was provided, and reassurance to her as well as her family was also given. Following which she progressed very well. She was very comfortable with the nursing care given to her during her stay in the hospital. And post-op surgery on day 3, she was already sitting up in bed, and she was able to understand that her progress was going in the manner that was predicted. So when she was ready to go home, she was advised to have a home care service, which included a home care caregiver and also physiotherapy, which was recommended by her physician and her orthopedic doctor, Dr. Prashant. So we encouraged her and we introduced her to who will be her caregiver 24 hours a day. And also her physiotherapy was scheduled every day at a particular time, which was comfortable to her. So with that satisfactory results, she went home, and so from the following day onwards, her home care started. Home care included helping her cope with her daily needs, what she needs to do in the morning, help her brush her teeth, groom herself, so she'll feel a little comfortable even though she was not yet fully ambulatory. And then physiotherapy also used to come in once a day for 1 hour, so they will have minimal movements, encourage her to move herself, do some breathing exercises, bring her mood up, and also to make her feel that her normal activities will soon progress as time goes. Where we saw improvement over a week or two because her mood changed. Her range of movements also kind of increased, even though they were minimal, but it increased and there was a lot of progress. Home care services were given to her when she needed, because she's a diabetic patient, she needed some blood sugar tests that were used to be done. So we provided those services. Those services were given to her. So at home, blood was taken and results were sent to her on her phone, and our doctors used to review them and advise accordingly. So we also had home care nurses go home, do her dressing for the wounds, encourage her to say wound healing is going okay, which was more of a motivational thing for her, and also helped her progress and recover from a long-term surgery because of her age. Her age played a role where she was little bit depressed because she already 70 and above. So she was wondering how she will get up, how she will move, how is she going to do her normal activities. So that in that situation, home care and physiotherapy played a very major role, because one of the key aspects was the caregiver being with her all the time, encouraging her to do things and helping her focus on like daily activities, cheering up, letting her watch television, like things like that. So that was a major improvement, and she appreciated a lot of what specialist offered to her at home in the setting where it was comfortable for her. So she did not have to make the effort to come to physio or move around a lot, and especially with the COVID situation, it was also another risk because of her age factor and her comorbidities of being diabetic. So when she reached a level of after a month, when she had to come in for a check, Dr. Prashant recommended another month of physio, so she'll feel more confident. So that was a huge motivation for her, saying that yes, progress has been happening, and she appreciated all the efforts put in from the physio team and for the home care team of what all they did to encourage her and have her progress to that point where she only needed just one more month, and then she was able to use her walker. So every day of physio, it changed from just being on the bed, doing just physio exercises, lying on the bed. She started sitting up and doing exercises, so the legs were getting stronger. She was able to stand for 5 minutes. Both the home care person, home care caregiver girl, plus our physiotherapist used to be there every day, motivating her on either side to start with 2 minutes, 4 minutes, and then it became 10 minutes. So she gained confidence, plus the strength of her bones and her muscles happened, and soon she progressed to using a walker and helped to walk around just a few steps. After using the walker, she was very much back to herself. because we saw her mood change. She bonded very well with our caregivers. She bonded very well with our physiotherapist, which played a major role in getting her back to herself and also in the healing process. At the same time, there was also a review given to Dr. Prashant about her progress from the physiotherapist as well as from home care on how she's progressing, which was very satisfactory. And Dr. Prashant also was happy with the result which was expected. Right now, she is also still progressing, and she is carrying on doing all her daily activities almost by herself. But she holds specialists in high spirits because of the situation that happened and how it happened to her and from where to where she has progressed. So specialist always has a very special place in her heart, and the family itself owes a lot to specialists and especially to home care and physiotherapy department, which we are grateful because it means one of our patients has reached the level where we wanted to, and even more, because when we see results physically plus emotionally, it adds to the results that we are looking for.